Hello and welcome to MedPrime Academy. Today I would like us to learn how to image the uterus in pelvic ultrasound. So you have on the screen two images. One is a cine image and the other is a still image of the uterus in transverse and longitudinal sections. In the first image, we have the uterus in longitudinal section, and I would like us to see some few structures that are displayed. But before we come to the structures, I would like you to pay particular attention to this. This is the curvature of the probe you are using. That's the curvilinear probe or the convex probe, okay? And this is the skin. So that is the skin and the subcutaneous tissue. Before you come to a completely anechoic structure here. So this is the urinary bladder with the urine inside the bladder. All right. And then before you come to the pyometrium of the uterus, that is the outer lining of the uterus. So this is the pyometrium. That is the outer lining of the uterus. And then we come to the myometrium. So the myometrium is the muscular inner lining or middle lining of the uterus. And then you come to the endometrium. The endometrium is the inner lining of the uterus where the fetus implants itself after fertilization. We have a couple of structures yet to be displayed. So from right about here to here is the uterine cervix. Okay, the cervix of the uterus. This is the internal os, and this is the external os. Then from here going up there is the vagina. So if you would like to see the uterus in the total length of the uterus and see the cervix and even the vagina, you would have to do a longitudinal scan, or you have to go longitudinal to be able to see the entire length of the uterus. The second image is a transverse image or a transverse orientation of the uterus, and we do transverse to be transverse ultrasound, or we take the image in a transverse orientation to be able to see structures like the ovaries. This is the left ovary, this part of the right ovary. We can still see the endometrium here, and then the uterine body, and of course the anechoic area here is the urinary bladder. Thank you, and I'll come your way once again. Bye.